Welcome to this presentation on infection prevention and control. So we're going to look first of all at keeping everybody safe. And to do that, we need to refer to the Health and Social Care Act of 2008, the Code of Practice for the Prevention and Control of Healthcare-Associated Infections. And this stipulates that all organisations that provide healthcare must put in place effective systems for the prevention and the control of infections. This means that they must provide clean facilities, and they must also have in place policies to prevent infections and also to ensure that all staff follow these policies. It also says that we must take reasonable steps to keep staff safe from healthcare-associated infections. So we're going to look first of all at the risk assessment process. So an overall risk assessment must be done by all healthcare providers. And a risk assessment must take into account a number of things. So first of all, hazards. So where and when infection could occur. The risks. What could happen if the hazards identified were not addressed. And also to look at the people at risk, so identifying who might be at most risk of infection, so whether it's the elderly, the children in your nursery, people with compromised immune systems, whoever the target group might be, and also to look at individual procedures. So, for example, toenail cutting or wart removal, things that are done regularly in your specialised healthcare setting. And then also to look at standard infection control precautions. And precautions are in place to prevent the spread of infection. And precautions are important to protect patients, service users, staff, and the general public, so everyone who is involved in your setting. And precautions should be applied in all areas of healthcare activities and procedures. So just looking again at standard infection control precautions, and firstly we'll look at the responsibilities of staff. So it's the responsibility of staff in your employment to attend the training which you provide. If staff do become ill from exposure to infections, they must report it to their line manager and they must be aware of this process. All staff must follow procedures which are put in place, and they must all stay up to date with national and local laws with regards to healthcare associated infections. And that is the responsibility of your staff. And then we're going to look at who is at risk. So there are a number of vulnerable groups, and these include drug users, people who are frequently in hospital, people who have lowered immunity due to age or illness or even malnutrition, people with acute wounds, and also people who use equipment, and especially that which may be internal equipment such as catheters, for example. How are infections transmitted? So there are a number of ways in which infections can be transmitted. So first of all, the most obvious one is through direct contact. And this is through any physical contact between a healthy and an unhealthy or infected person. And then indirect contact. This occurs when transmission occurs through the infection on surfaces, or through infected air droplets, or through a bite, for example. And then finally, ingestion. So fecal oral ingestion is the most common, and this is usually through an intermediary step, such as food, for example, or water. Infections are also airborne, and the common ones would be the common cold, but viruses, fungi, or bacteria can all be spread through the air, through coughing and sneezing, and also through bites, so either an insect or an animal bite. So you must be aware of secondary infections that can follow a bite, such as cellulitis, folliculitis, lymphangitis, or impetigo. And if you look at the image on the screen, this is an MRSA bacteria, and that's been magnified by a scanning electron micrograph. They are very simple, but can cause such harm. You can also be infected via a blood-borne virus. These are also known as BBVs. And there are a number of ways in which blood-borne viruses can be transmitted. So through sexual intercourse, through the sharing of infected equipment, or through a contaminated skin puncture. Transmission can also be vertical, and by that we mean during the process of childbirth from the mother to the child, as such as occurs with HIV sometimes, the contamination of wounds, or via blood transfusion, although in the UK now all donated blood is carefully screened. So just a little bit of information for you about bloodborne viruses. So healthcare workers' safety is covered by the Health and Safety at Work Act of 1974, and this stipulates that it's the employer's responsibility to make sure that procedures do exist and are in place for the prevention of the risk of bloodborne virus infections. And all employees also do have an obligation to comply and cooperate with their employer. Looking at hand drying, wet hands are the perfect place for microorganisms to breed. So you must always ensure that your hands, after washing, are dry from fingertips to wrists. And you should always use a disposable towel and dispose of it carefully using the correct bin that's provided. Self-feeding hand towels, for example, from a dispenser are ideal. And then looking at alcohol gel, there are positives and negatives to the use of alcohol gel. So positives, essentially it's very simple, quick and easy to use, and you can use it between patients without having to go and wash your hands at a basin. And you can use it when you go in and out of a ward or a room or a house even, if you're a community worker. And if you use it after gloves, it will kill 99.8% of bacteria. On the negative side, it doesn't work to kill diarrhea-causing viruses, such as norovirus or other small round viruses. You should only use it on physically clean hands, so hands that look physically clean. If you're not sure, then you should go for soap and water. Staff should also be aware of alertable and notifiable conditions. So alert infections are those which need to be reported to the local infection prevention control team. Some alert conditions are also classed as notifiable, and it is a legal requirement to report notifiable diseases to communicable disease control, and this is the responsibility of the doctor in charge. Employees themselves have a responsibility to report to their manager or appointed person, who will then escalate as necessary. We're just going to have a quick look at alert and notifiable conditions. So alert conditions include mumps, ophthalmia neonatorum. Any rash on a child needs to potentially be looked at. Polio, pyrexia, which is a high fever or temperature. Parvovirus, which is also known as slapped cheek. Rubella, also known as German measles. Scabies. Scarlet fever, which again is currently on the increase. Any acute soft tissue infection will require assessment by a medical professional. Infectious vomiting or diarrheal illness. Chickenpox. Food poisoning. Influenza. Measles. Meningitis, either viral or bacterial. Meningococcal septicemia. Tuberculosis. Typhoid. Viral hemorrhagic fevers and hepatitis B and C. Specific notifiable conditions include polio, typhus, a viral hemorrhagic fever, yellow fever, which may occur in individuals travelling in from sub-Saharan Africa, cholera, food poisoning, plague, dysentery, tuberculosis and measles. We also follow the RIDDLE acronym. So this is the reporting of injuries, diseases and dangerous occurrences, the regulations of 2013. So employees are required to report incidents or exposure to infections that can be transmitted and which may impact upon their work. So for this, all workplaces would have an accident report book. Looking at multi-drug resistant organisms, known as MDROs, an MDRO can be transmitted and so therefore it needs to be controlled. So where possible, A separate room must be provided to a person who does have an MDRO. The local infection control team must also be consulted. And as an MDRO can be transmitted by either direct or indirect contact, then hand washing is an essential control method. Additional methods of control, such as gloves, masks, or aprons, may also be needed in certain situations. A medical microbiologist will advise on treatment for individual MDRO cases. So now we're going to look at cleaning when MDROs are present. So special care must be taken in the cleaning of the environment where such a patient has been resident or is still resident. And areas that collect dust must be specifically cleaned with great care. We recommend the cleaning using sodium DCC at 1,000 parts per million, and 1 tablet in 1 litre of water will provide an adequate, powerful cleaning solution. We're just now going to look at some common healthcare associated infections and how they're transmitted. So Clostridium difficile, this is a digestive bacterial infection which causes a very high fever and abdominal cramps. It's easily transmitted and it can last for a long time and make patients very ill. It can easily be prevented by good hand hygiene. Norovirus is also known as the winter vomiting bug, and this has a 12 to 48 hours incubation period. For infected patients, water and rest are recommended, and the patient must avoid becoming dehydrated. It generally lasts 2 to 3 days, but it is highly infectious, and any infected patient must avoid visiting healthcare facilities, whether that be care homes, nurseries, or hospitals. Chickenpox is another disease which is highly infectious. It has a common spotty red rash which looks like it may have water-filled blisters. It's mostly mild, but in some cases, particularly in people with an immunodeficiency, it can be very severe. People who are also on oral steroid treatment in the long term may need to seek additional advice. So it's particularly common in children under 10, especially between March and May, but no treatment is generally necessary for most infected children or individuals. And it's infectious for 5 days after spots first appear. And once you've had it, then the patient will be immune. And healthcare workers and carers who have not had chickenpox must have the vaccine administered by occupational health or their GP. Shingles occurs when the patient suffers reactivation of the chickenpox virus, and it's most common in individuals over 50. People who have shingles have previously had chickenpox, and once the lesions have scabbed over, then they're no longer infectious. Just looking at infection control and precautions. So firstly, hand hygiene. Secondly, the use of personal protective equipment. So that will be gowns, masks, gloves, respirators and goggles. Healthcare workers must also adhere to the antiseptic or aseptic technique, which keeps the environment and equipment sterile to avoid microorganisms contaminating and entering the site. The antiseptic non-touch technique, also known as the ANTT, is of vital importance. This ensures that no contact is made with wounds unless completely sterile. Sterile gloves should be used. Also, some patients may require barrier nursing or being placed in isolation. The patient is kept isolated in extreme infectious circumstances, and this is usually to protect other patients and staff. If a patient or healthcare worker needs to sneeze, they should cover their nose and mouth with a disposable tissue and put it straight into the waste bin. They should then wash their hands. Spillages are also important, so spillages must be cleaned immediately. Appropriate skill kits exist and should be available for body fluid spillages. So a named person needs to be available to be responsible to ensure that these are maintained. If there's a spillage, then the area will need to be safely cordoned off and personal protective equipment will need to be used. A large spill may require more than one person to clean, and a major spill requires an individual risk assessment and guidance from the line manager. A cleaning specialist may also be required. When managing infectious diarrhoea, we can follow the SITE acronym. The S is when we suspect a case. The I is for patient isolation. So at this stage, then advice needs to be sought from the relevant healthcare professional in charge. G is for gloves and aprons, which are to be used at all times. H is for hand washing, thorough hand washing with soap and water. And T is for stool testing for toxins, so the specimens will need to be sent off. And there are guidelines available for clear and adequate hand washing. When you need to use gloves, you need to be sure that they're well fitted and that they're not too loose or too tight. If they're too tight, you won't be able to move properly. If they're too loose, they may well fall off or become a nuisance. And only gloves which have been risk assessed to be safe should be used. When you remove your gloves, you need to take care that contamination doesn't occur, especially with clothing and other surfaces. The glove should be pulled down from the wrist, turning it inside out and disposed of safely. And you should wash your hands or use Alka-Gel after you've removed your gloves. When you use aprons, this will usually be because you're in contact with an infected patient, and disposable aprons exist for this purpose. They're also often colour-coded for specific tasks. Full body gowns may need to be used when there's a high chance of a significant amount of bodily fluid splashes. Like gloves, aprons should be carefully removed and turned inside out, and then rolled into a ball before being disposed of safely. When we're using eye masks and face and mouth protection, there are also guidelines to be followed. So the equipment should be well fitted and comfortable, and the user should always follow the manufacturer's instructions. Eye masks and face and mouth protection should again always be removed and disposed of carefully and should not allow contamination with any work surfaces, clothing or skin. Management of disposable equipment also requires guidelines. Non-disposable equipment includes stethoscopes, thermometers, drip stands and infusion pumps and other similar equipment. You should take advice from your local infection prevention and control team when a specific highly contagious infection is present. Equipment should always be stored in a clean and dry place off the floor once appropriately cleaned. And equipment should also be cleaned according to a schedule when it's visibly dirty or when it's been in contact with a spillage. In terms of management of the environment referred to is any frequently touched horizontal surface, and this includes items such as beds, trolleys, lamps, tables, telephones and televisions. It includes all surfaces and items in a bathroom. It includes all door handles, curtains, screens, paintwork and blinds. And a routine cleaning schedule should be based on the NHS standards for cleanliness, which are easily and readily available. Cleaning chemicals should also be stored under COSH guidelines. There are also guidelines for linen management. All used linen should be handled as if it potentially harbours an infection, as you do not know whether it does. A disposable apron should be worn, and linen should be held away from the body, turned inside out and rolled into a ball. Hands should be washed after handling linen, and red sacks are an ideal way to transport safely linen which is dirty. Staff should also wear a clean uniform at the beginning of every shift. Staff should not travel in uniform, but should change on arrival at work. They should wear short sleeves, as cuffs which come into contact with patients and materials are an infection risk. Shoes should have a closed toe and not be open. Staff should not wear ties, and all uniforms should be washed on the hottest setting. We're going to look now at occupational exposure. All healthcare workers should assume that everybody has the potential to be carrying an infection. They must follow precautions, including personal protective equipment where required and good hand hygiene. The greatest cause of occupational exposure in a healthcare setting is a needle stick injury. So sharps must always be disposed of in a sharps container, which should be assembled properly, sealed, and which should remain out of reach of children and vulnerable adults. And it should only ever be 3/4 filled. When you assemble a sharps bin, you need to sign for it, and again, you need to sign when it is sealed. The second highest cause after this is splashes of blood and other bodily fluids. So for this reason, cuts should be covered with a waterproof dressing. All staff should also maintain their immunisation status. All exposures must be reported to the Occupational Healthcare Service by the staff in charge of the employee during the time of exposure. There are some simple first aid guidelines. So if a patient is cut, then the cut should be allowed to bleed under warm water and washed with soap. It should then be covered using a waterproof dressing. Any contamination of eyes and mouth should be dealt with by using wash kits, if these are available. Staff are responsible for their own health too. They should take their own precautions with regard to chemical hazards, and these include drug and cleaning substances, biological hazards, which includes blood-borne viruses, and ergonomical hazards, such as heavy lifting, for example. Staff who present to work with vomiting and diarrhoea must be sent home and should not attend work for 48 hours. And all staff should be made aware of local reporting policies. Thank you for listening. We hope you enjoyed the course. In order to gain your certificate, please complete the test.